Thank you for coming back to video number 3. I'm Rebecca Gordon with Gordon Marketing. If you haven't checked out our website, do so. We have some amazing tools and features on there, such as our Medicare free quote engine, where you can go on, no matter where you live in the United States, plug in the zip code, age of your client. It's going to give you the most competitive med subs. It also does Med Advantage and Part D. We also have a final expense quoter on there, as well as annuity and term life. So a lot of great agent-friendly tools that you need. None of it is password protected, so you can get on at any time. So it's gordonmarketing.com. Check us out. Okay, the first 2 videos, we're talking a lot about open enrollments approaching us. And I said on my previous video that we were going to talk about small group. Before I get to that, I don't want you to forget about business that you should be writing in 2013. So if you look at the big picture, we have 2013 business we can still be writing and 2014 business. 23 business, 2013, this business is underwritten, right? All insurance companies still want health business with an effective date of 2013 because it's underwritten. They can decline it. So that means that the insurance companies have a choice of deciding what risk they want and what risk they don't want. So what they're doing is they have a lot of perks out there for the agent to write as much fresh business in 2013 as they can. There's only one carrier that is guaranteeing rates and benefits, and that's Assurant Health. If you are contracted with Assurant but you haven't written in 6 months, give us a call. I want to earn your business and get you contracted and teach you how to be using this. But they are the only carrier. A lot of my other carriers are guaranteeing benefits, but they're not guaranteeing rates, so we could still see a trend. Assurant is saying, look, any business you write with a 2013 effective date, okay, this is business you wrote after April 1st of 2013, will guarantee it until, or I should say, I'm not allowed to say guarantee, scratch that. I will say they will not change rates or benefits until December 2014, okay? 2013 business also allows you to be creative. What do I mean by that? If you've written a lot of health insurance and you've been successful, you're very creative because it's gotten very difficult. You've had to raise deductibles to lower premiums. You've had to add more coinsurance to lower premiums. You've had to look at this but not look at that. Talk high deductibles, talk this, talk that. Don't use this, use that. All in an effort to get a low price. 2014, we have no creativeness left. We are simply order takers in 2014, right? What's your name? Where do you live? Do you smoke? You don't? You have health insurance. That's it. So we have no creativeness. Here, I can still be creative and I can still drive down the cost. So today I did a rate, 40-year-old female. When I went on the Kaiser Family Foundation and I ran a rate on the calculator, it was $320 a month. That was my person who made $45,000. They didn't qualify for a subsidy. When I went on Assurant, ran the exact same rate on CoreMed, I could drive the rate down to $189 a month. That's a no-brainer. That way I can take my existing client or my new client, and I like to call it sidelining them. I want to sideline them in 2014. There's going to be so much confusion. There's going to be so much turmoil, right? This is the guinea pig year. 2014, we're all just guinea pigs. And what I want to do as an agent is I want to protect as many of my clients as possible. Who knows what we'll be facing a year from now? Things could totally be different. There'll be a lot of changes, a lot of growing pains, a lot of tweaks. So if I can either take that in-force client I have on the books now or my brand new client, get them underwritten, issued with the 2013 effective date, I'm going to lock them in until December 2014. That is a win-win-win. In 2014, well, it's guaranteed issue, so that's good. Everybody's issued, right? I have no creativeness. In 2014, we have to really think about the word volume. we got to look at this picture as writing a bunch of people. No longer the days of writing 10 to 12 major medical policies. If that's what you're doing, you need to kind of refer that to someone who's going to be looking at the big volume. And that's where we are expecting to see projections of 50% higher rates. Everybody has to get it. There will be a penalty. But I don't want you to lose sight of this opportunity, 2013. This is huge. Now, when I say that, the big opportunity in 2014, I believe, is going to come in the small group market. Again, I said the small group market thrived because it was a guaranteed issue platform. So if I was an employer and I had 5 employees, and we'll say one was my husband, and we'll say he was a diabetic. Not getting health insurance, my only option, small group. And so that's what happened. So this market got killed with guaranteed issue business. The claims experience is way up here, so in order for the insurance companies to try to offset the claims, they have to keep raising rates. So we don't have to worry about that anymore because the individual market is going to guaranteed issue. So what I am suggesting, keep in mind, 87% of the workforce in the United States is made up of small businesses, 5 to 15 lives. They're everywhere. We're everywhere, right? God bless the small business owner. We're the one who makes this country run. And as small employer, we're handcuffed with a lot of the small group laws. So if we offer small group coverage, I have to offer it to everybody. And I have to pay a certain percentage no matter what. No matter if that person takes care of themselves or doesn't take care of themselves. I have to do this. I have to do that. I have to do this. I've never been a fan of that at all. So I can go into these small employers and say, look, we have really 2 options. One, stay put. How much do you spend on your small group now? All right. Well, let's look at writing individual policies. So here's option 2. We could either put your lower earners in the marketplace and see if they get a subsidy. They're not getting a subsidy over here. Let's see if they could get a subsidy. That's a perk. Subsidy. And maybe, as the employer, I decide to give my folks a raise. And then add that up. My higher earners, my people who wouldn't qualify, I'm going to put them in the private sector. I'm not going to put them on the government-ran, federally ran program. I'm going to put them in the private sector with Assurant, with Golden Rule, with Anthem. And then I'm going to add that up. If these 2 added up are less than that, well then by golly, you have a winner. You've also just taken your employer out of the group, out of the insurance business. Your employer is not meant to be a master of insurance, all right? Luckily, I'm in the insurance business, so I am a master. But the traditional employer shouldn't be a master in it. This takes that employer out of it. You guys go buy your own insurance. I'm going to give you a recommendation where to go. That would be your job, the agent, directing them to the marketplace or the private. Your employer then has the option of saying, look, I'm going to give you a raise. I might give you a $200 raise. I might give the private folks more of a raise because this is going to be more expensive. They're not getting a subsidy. So I see a huge opportunity here. Employers are worried about one thing, cost. That's all I care about. When I look at what my renewal is, all I care about is cost. I don't care as the employer what the doctor office copay is. I only care about cost. My employees, on the other hand, they care about doctor copays and drugs. By taking them off of a group plan and putting them in the individual market, you're giving them amazing coverage, right? Health reform is giving every American access to amazing benefits. Amazing. So as the employer, I don't have to worry about my employees getting inferior products. The government's already backed that. You're getting awesome, awesome plans and benefits. But if I can save you money, which I bet I can, that's a win-win. Chances are you're going to uncover enough savings to warrant these raises. Big question I get, well, Can the employer pay the premiums? No, an employer cannot pay premiums. You have to be a small group then. But an employer can give raises. Now that will cause the employee's income tax to go up, right? Because that is income. But the employer can do that. I am all for saving employers money. This is what it comes down to: providing great coverage, benefits that people understand, giving people quality care, and keeping the price affordable. If you have questions, give me a call directly. I have 9 marketers in my office. We're all very well versed in major medical. We're all licensed. We all sell. And I'm really excited about this market. So as carriers are announcing their plans, those haven't been announced yet, commissions, we'll be doing a series of webinars. My email again is Rebecca, REBECCA, @gordonmarketing.com. Give me a call.